Welcome to this short revision video. The objectives of this video are to be aware of how to perform the procedure correctly, to understand why people fail this station of tenoscopy, and to know how to perform ANTT correctly. Some of the reasons that students fail this OSCE station is because they fail to follow ANTT guidelines, a lack of familiarity with the equipment that they're using, they use an incorrect technique, they unsafely dispose of sharps, they don't look practiced when they're doing it, and not treating the OSCE station as if it's real. Coming up with lines such as, "I wouldn't do this in reality." Treat any OSCE station as a real event. If you fail to get blood back, don't panic. Try again. If you continually fail, explain to the examiner that in reality you'd probably ask somebody else to try this, and then politely ask the examiner if you can proceed as if you did get blood back, so that you can show them that you are familiar with the procedure itself. On entering the station, present your library card to the examiner, wash your hands, introduce yourself to the patient using your full name and title, confirm that you have the correct patient by confirming their full name and date of birth, explain the procedure that you'd like to do and why you'd like to do it, and gain their verbal consent for the procedure. Begin the procedure by washing your hands using the alcohol gel provided, using a 7-step technique shown here. Next, take a chlorhexidine wipe and thoroughly clean the ANTT tray. Whilst doing this, you could explain to the examiner that if the tray was visibly dirty, then you would actually clean the tray with soap and water prior to cleaning with a chlorhexidine wipe. Since you've been cleaning, at this point you should wash your hands again. Next, prepare your equipment. Do not use the ANTT tray as just a receptacle for your equipment. All equipment should be removed from its packaging and placed in the ANTT tray. Make sure you pick the correct equipment for your site. There should be a cannula, an IV dressing, a chlorhexidine swab to clean the skin with, a syringe along with 2 needles to be able to flush the cannula with. Make sure you protect the key part on the syringe by putting the needle on the end of it before placing it in the tray. Some cotton wool or gauze. Now wash your hands again since you've been touching potentially contaminated packaging. Put on a pair of non-sterile gloves. Check your flush, which should be normal saline, and carefully draw it up. It's considered poor practice to draw up the flush without using the needle. It could well cause you to fail the station. Remove the needle manually and dispose of it in the sharps bin, and place a new clean needle over the end of it. Place your flush in the ANTT tray and dispose of your gloves. Wash your hands. Go over to your patient and apply the tourniquet. Palpate for a vein. Once you've identified the correct vein, release the tourniquet, take your chlorhexidine swab, break it and shake it, and then clean the skin thoroughly. Wash your hands again. Put on another pair of non-sterile gloves. Reapply the tourniquet to fill the veins again. Take your cannula and position it approximately 15 to 30 degrees to the skin. Do not repalpate the vein. Tether the skin with the thumb of your non-dominant hand and advance the cannula into the vein until you see the primary flashback in the upper chamber. When you see the primary flashback, pull back on the needle and you should observe the secondary flashback. When you can see that, you can advance the cannula over the needle into the vein. Once you've done this, release the tourniquet. Carefully remove the white cap, remembering that it is a key part. Occlude the vein at the tip of the cannula. Remove the needle and dispose it in the sharps bin and recap the cannula. Take your flush. Dispose of the needle manually, not using the side of the sharps bin, which could well be contaminated. And flush the cannula with a couple of mils of saline, making sure that it's in the correct position and it flushes easily. Once you confirm that the cannula is in the correct position, you can then secure the cannula using the cannula dressing as shown here. Finally, thank the patient and tell them that you've finished. Remove your gloves and wash your hands. Document what you have done. Tell the supervisor that you're finished and thank them. And clean up any mess. Thank you very much for listening to me. We hope you found this video useful.